Good morning, everybody. Where I come from, you people usually answer if you greet them. Now, first, let me just say that it would be very difficult for me to present all perspectives of sexually transmitted diseases in Africa because Africa is really, really vast. And given what everybody has said this morning, it would probably be very challenging for me as well to try and cover everything that they've said because what they've said is really relevant to what I want to speak about this morning. Let me start by declaring two particular potential conflicts in the sense that some of the earlier work that I shall talk about was funded by the NIH, and the current work with the POWER cohort, where we are rolling out pre-exposure prophylaxis, is funded by USAID. But let me tell you that about 30 years ago, as a medical student, my first introduction to sexually transmitted diseases was a little bit shocking. I went into a clinic that was called the Special Clinic because they treated sexually transmitted diseases and they also had dermatological infections treated at that particular clinic. Now, as a young medical student walking into that clinic, the doctor, who was very intimidating, was watching these patients come in, and he would then examine them and provide them with treatment. And a gentleman walked in, and we medical students were sort of cowered in the corner, trying our best to learn something from this particular experience, feeling afraid we might get asked questions about things we didn't know or couldn't really speak to. So this gentleman walks in, and the doctor tells him, "Lower down your trousers." And he says, "But excuse me," and he's told, "Please put your trousers down and take off your underwear." And the gentleman hesitates and stands there a little bit longer and says, "Excuse me." Then he says, "Do you want to get seen or not? Please do as I have told you." So the gentleman lowers down his trousers and his underwear, and he's standing there a little bit uncomfortably. And the doctor examines him and then says, "There's nothing wrong with you." He says, "Yes, the problem is between my toes." And that was my introduction to sexually transmitted infections. And I thought, yes, indeed, often people were treated without very much dignity and without people listening to the concerns that they had. Now, in the same way, when we talk about Africa, it is so diverse. There is so many different populations, so many different groups. So I won't attempt to try and talk about all of them, but I just want to remind you that even when we talk about Africa, we are not talking about the same things when we're talking about the young and the old. There are very many different perspectives. But we know that up to 17% of the total burden of STIs are within Africa, and we treat using a syndromic approach. There are drugs that have been available within the public health system, but we are facing a challenge of drug resistance, which we've not been able to monitor very effectively. When I started working in the field of STIs and HIV almost 30 years ago, it was at a border town of Kenya and Uganda in Busia where this first caught my interest because as a young doctor, I saw a lot of discharges. I saw a lot of women with pelvic inflammatory disease. And this is what got my interest in research in the first place, trying to figure out, was there anything that could be done and done better? And in the next few slides, I just want to convince you that the challenge that we seem to have had many years ago, we seem to have lost touch with what was happening, and the same problems are re-emerging now. The highest rates of incidence of sexually transmitted diseases we've been seeing, and I will use Kenya as an example because I believe it does represent what is being seen out in most of sub-Saharan Africa. It's a young girls and adolescent women who are of biggest concerns to us. But these young women are not necessarily having sex among themselves. There are other young men and other groups that are involved that we also need to be concerned about. And the young women come in many different sizes and shapes and in many different avenues of life. And there are many different things that they're doing right now. So we can't put them in a box and think that they're all the same. Some are in school, some are out of school. Some of them are economically empowered, some of them are not. Some of them are mothers, some of them are not. In 2008, we were doing work, and this is what was funded by the NIH, among the fishing community. And we're looking at what were the prevailing sexually transmitted infections. were particularly interested in the fishing community, the men in particular, because we thought that they had high rates of STIs. We were also concerned about HIV and were interested in finding out how could we provide treatment to them because of their being very mobile, and because then that presented a challenge in terms of follow-up. We found that there was an HIV prevalence at that point in time of about 25%. And I want you to particularly notice that there was very little gonorrhea and chlamydia within that group, because in the next few slides, I'll be talking about what we are seeing in the current young women who are a group which is within this same population, within the same area, and just the worrying trends of what we're seeing right now in terms of chlamydia and gonorrhea. Within this particular group, we had very high levels of herpes simplex virus, type 1 and 2, and high HIV, and were able to then move on to start initiating individuals on treatment for HIV and trying to figure out how do we follow them up, even within their mobility, how do we get partners tested, how do we get individuals notified. Not very easy. Right now, almost 10 years later, we've been focusing, and this is what has been funded by the USAID. The POWER cohort is a young cohort of women aged between 16 to 25. We're trying to understand how do we roll out pre-exposure prophylaxis for this group? What works for them? Are they able to take it? How long do they want to take it for? When do they go on or off PrEP? And within this particular group, we have been testing them for some specific STIs using NAT testing with urine. Out of the 400 women we have tested so far, a quarter of them have been positive for either gonorrhea or chlamydia. Between 25 to 30% of them are infected. Now that's what's concerning, that in the last 10 years, clearly we've lost our touch in as far as STIs are concerned, and there clearly is a reemergence within this particular place. We are seeing that it's highest in those who are aged between 20 to 22. Remember, this is a cohort that is limited. We are taking 16 to 25-year-old young women. And the majority of these individuals are actually single. They are not married. What is the concern? I had a discussion with someone from our national STD program in the last week, and she said to me, we do not have enough data. Nobody is monitoring STIs enough in the country. As a result, even though we are treating syndromically, we don't have evidence on which to make good decisions. In addition, she said, we are not testing for STIs routinely. So we really don't have a good sense of what's going on in the country. We are aware that there may be some pockets of drug resistance within the country, but again, we are not testing this very consistently. Of concern is that now we have a new cadre of healthcare workers who have not been trained on STI management as a focus. While it's part of their general training, it has not been a focus, and so they're not even looking for STIs. The young women I'm talking about who we tested are asymptomatic. They're women who are HIV-free, they're healthy, we are recruiting them for PrEP. They came in with no symptoms whatsoever, and yet up to a third of them are infected with either chlamydia or gonorrhea. And then, of course, our health systems continue to be a challenge because we are trying to make sure that we have some form of universal health coverage, but we are far from getting there. So let me tell you a few stories before I close. In the fishing community, often the young men are concerned that they never know when they go out into the lake whether they will come back or not. Talking to them about STI prevention seems like a very small matter in the bigger issue of their lives, because they say, first of all, I don't know if I'm going to come back. I want to enjoy life today. I can't wait for tomorrow. When you talk about use of condoms, they say, who eats sweets with a wrapper on it? You can't taste it appropriately. We have the older group of men who often are the ones who are having sex with the young women we are concerned about. Many of them, even when we offer opportunities for voluntary male medical circumcision, they are not interested. For them, it's not cultural, it's not appropriate. They do not want to have STI prevention options. They're young professional women who we are sometimes concerned about. We mainly see them perhaps in the family planning clinics. But in the family planning clinics, they are focusing on issues of contraception. They're not thinking about sexually transmitted infections. They won't even test. They won't even ask questions about potential risks. For many of these women, their risk is not their own, it may be their partner. But if they're not thinking about what their partner is doing, we are unlikely to pick it up. We have the young professionals. They may be heterosexual, they might be gay, they may not self-identify. Have a hard week at work during the week, party night, or party hard over the weekend. Are they thinking about sexually transmitted infections? Are they concerned about condom use? Are they even thinking about PrEP? To finish off, there are many women whose main concern is the child on her back. Will that child have food today or tomorrow? What will they do to just be able to make their lives and the lives of their children a little bit better than it was today? And even when we are talking about the big picture of protecting themselves against STIs and even HIV, that is none of their focuses. In a nutshell, STIs have become a problem. I think we have not been paying attention to it, and now it's catching up with us. We do need to do something about it. Thank you very much.